Yeah, I got into this by visiting a podiatrist at Michigan State University, and I was looking at dentistry. My dentist actually talked me out of becoming a dentist. I looked at a podiatry office in Lansing, Michigan, and went to school at Temple University, and here I am today. And I'm from Detroit. I did my residency in Toledo, and that's why I'm still here. I like Toledo. I did not want to go back to Detroit. And it's been a satisfying experience. Medicine was and this is one of the main reasons I went into it, aside from wanting to help people, was it was allowed for a lot of independence. So I went into practice in 1982, where it was just fee-for-service, usual, customary, and reasonable. Then it went into the HMOs, PHOs, PPOs, and you started to see hospitals starting to infiltrate with insurance companies, and they started to regulate how things were reimbursed. They started to lower the reimbursement rates. And then it just started to escalate to where today Medicare pretty much dictates how things will be paid, what will be paid, and everyone follows suit. You're seeing people's deductibles increase dramatically, from where there were no deductibles to where now people are paying at sometimes $75 for a copay. Their premiums monthly have gone up tremendously. So the out-of-pocket, their out-of-pocket expenses like personally. Now this is what I find, I love sharing this with patients, because you would think, as a doctor treating patients, I have probably the best insurance you could get because I'm inside. I've got the inside scoop. I have to go into the private market. I have Medical Mutual. My deductible is $5,000. So I'm not getting some special deal. And it's very expensive. The monthly premium, the out-of-pocket expenses, and everyone's experiencing this. Our practice is a very busy 3-doctor practice. Very busy. We are reaching a point where we cannot run fast enough, and when I say that, I mean see enough patients to pay overhead. We're reaching a point where the reimbursement and expenses are going to start to cross. Those lines are going to cross, meaning we will not be taking in enough money to pay our overhead expenses. So what we've done is we are going to become hospital physicians, where the hospital is going to essentially take over our practice. From an external standpoint, you won't see a difference, but we are going to be hospital physicians. I would regulate the insurance industry. I would make it fair for everybody. So I would create insurance overhaul to where the insurance companies are not unilaterally making decisions on what's covered, what's not covered, what they think is necessary, what isn't necessary. And if that would require a panel of doctors, politicians, insurance executives. The point is, this is all being done behind closed doors, really without medical input. And they're doing it for financial reasons, not for what's best for patient care, which is the whole point of this. Now, arguments have been made that turn the whole thing over to Medicare. Have Medicare insure all of us. One payer. Medicare hasn't done a bad job. You know, it's scary to think of one entity controlling the entire health care, which is a large part of our economy. But the insurance industry does need to have regulation that they don't have now.